I wish I'd learned this sooner. Because for most people, the words root canal trigger one thing: fear. Maybe you've heard stories. Maybe a friend winced telling you about theirs. Maybe just hearing the name makes you want to reschedule or cancel altogether. We hear that every single day. And that's exactly why we want to talk to you today. Because what most people don't realize is that the story they've been told about root canals, it's about 30 years out of date. So let's change that. Here's the truth. Inside every tooth, beneath the hard enamel and the layer of dentine underneath it, there is a soft inner chamber called the pulp. This pulp contains nerves, blood vessels, and connective tissue. It's what kept your tooth alive while it was developing. But once a tooth is fully grown, it no longer needs that pulp to survive. The tooth can function perfectly well without it fed by the surrounding tissues. The problem comes when that pulp becomes infected. This can happen from a deep cavity that goes untreated, from a crack in the tooth, from repeated dental procedures on the same tooth, or sometimes from an injury you didn't even know caused internal damage. When the pulp gets infected, the bacteria begin to multiply inside the tooth. The infection spreads, and without treatment, it can reach the bone, cause a painful abscess, and ultimately cost you the tooth entirely. That's where a root canal comes in, not to cause pain, but to stop it. So how does a root canal actually work? A root canal is a treatment designed to remove that infected or inflamed pulp, clean and disinfect the canals inside the root of your tooth, and then seal everything so the infection cannot return. Here at Oaks Dental Clinic, here's how we approach it. First, we take an X-ray to get a clear picture of your root canals and see exactly where the infection is. Then, we apply local anesthetic to the area. And this is the part most people are surprised by. Once you're numb, you shouldn't feel pain. You may feel pressure, movement, sensations, but not the sharp pain people expect. Most of our patients tell us afterwards, "That was nothing like I thought it would be." Once the area is numb, we place a small protective sheet called a dental dam around the tooth to keep it clean and dry during the procedure. Then, using very fine dental instruments, we make a small opening in the crown of the tooth, the top surface, to access the pulp chamber below. From there, we carefully remove the infected pulp tissue. We shape and clean the root canals. There may be 1, 2, 3, or even 4 of them depending on which tooth it is, using a series of progressively sized files. We irrigate the canals thoroughly with an antibacterial solution to flush out any remaining bacteria. Once everything is clean, we fill the canals with a safe, biocompatible material called gutta percha, a rubber-like substance that seals the space completely so bacteria cannot re-enter. The opening is then sealed with a temporary or permanent filling. And in all cases, a root-canaled tooth always needs to be covered with a crown because, once the nerve and blood supply are removed, the tooth becomes more fragile and is more likely to crack or break over time. A crown helps protect and strengthen the tooth so it can function normally again. The entire procedure typically takes 1 to 4 appointments, depending on the complexity of the infection. And then, life goes on, with your tooth intact. Now, you might be wondering, is a root canal right for me? If you're experiencing a severe toothache, especially one that lingers after heat or cold, if you have swelling or tenderness in your gums, if you notice a pimple-like bump on your gum near a tooth, if a tooth has become darkened or discolored without explanation, these are all signs the pulp may be affected, and it's time to come and see us. The earlier we catch it, the simpler the treatment. And here's what we want you to understand above everything else. A root canal is not the villain in your dental story. It's the hero. It's the treatment that saves a tooth you would otherwise lose. It's the procedure that takes you from real, debilitating pain to relief, often within a matter of days. It's one of the most successful treatments in modern dentistry, with a success rate of over 95%. At Oaks Dental Clinic, we know that walking through our doors with a painful tooth takes courage, especially if dental anxiety is something you carry with you. Our team is trained to make this experience as comfortable, as calm, and as clear as possible. We'll explain every step before we do it, we'll check in with you throughout, and we'll make sure you leave understanding exactly what happened and what to expect next. Because you deserve to feel informed, not just treated. If you've been putting off a dental visit because something doesn't feel right, or because you're worried about what we might find, please don't wait any longer. Pain in your mouth is your body telling you something. And the sooner we listen, the better the outcome for your tooth, your smile, and your overall health. Book your appointment at Oaks Dental Clinic today. Head to our website, give us a call, or send us a message, and our friendly team will take care of you from there. Because a root canal isn't something to be afraid of. It's something that gives your tooth a second chance. and we'd love to help you keep your smile whole. Oaks Dental Clinic.